Good morning, everybody. It's Dr. Galvin with this morning's post-emergency department shift coronavirus update. Again, I did work in the emergency department last night. It is 8 o'clock in the morning or so. I typically work from 10 p.m. to 6 p.m. It's a little shorter, but normally that shift is 8 p.m. to 6 p.m. But they've cut our hours because of volume in the hospital. I'm not really going to talk about numbers today, but I am going to just talk a little bit about what's going on in the emergency room because a lot of people seem to be interested in that. You know, the emergency department is a crazy place sometimes, and it's sometimes hit or miss. And one of the weird things is that, you know, when this virus came out, as physicians, we all were bracing for this massive, influx of very, very sick people. And the fear was that the system was going to get overwhelmed. And, what happened was that we instituted social distancing and we were able to flatten the curve. And so the number of COVID-19 patients, while it's still there and we're seeing them, never really got to the point where they overwhelmed the system. But an unintended consequence of that was that everyone got scared to come to the hospital. And so now we're actually dealing with the opposite problem, that it's slow around here because of the fact that people are afraid to come to the hospital, and actually people are staying home that really need to be coming to the hospital. Because of that, there are furloughs going on, and doctors being laid off, and nurses being laid off, hours being cut, pay being cut, in large part because the majority of the hospital's income is actually from elective surgeries and sort of routine procedures, all of which have been canceled in fear of the virus. Now here in North Carolina, we've restarted those things just recently. Elective surgeries and routine procedures, things like colonoscopies and biopsies and routine follow-up stress tests and things of that sort. That's the lifeblood of the hospital, and that's what really drives the majority of the revenue. And so that's been cut off for a couple months, and it's the hospitals are hurting because of it. What are we seeing in the emergency department? It's getting busier, certainly. Certainly seeing last night some COVID-related patients, some of whom were relatively sick. Did not have anybody last night sick enough that needed to actually us consider putting them on a ventilator. We've talked about the changing idea of treatment of COVID-19 and how when people came in severe respiratory distress with very low oxygen saturations, the right thing to do for anybody else is to put them on a ventilator because they'll get respiratory exhaustion and they'll stop breathing and then they're going to die. And it turns out that folks that have pretty severe COVID actually don't tire out as much because they for some reason can tolerate lower levels of oxygen. And we think that the oxygen levels are reading low on our monitors because of an effect the virus has on hemoglobin. So, they don't call it medical practice for nothing. We don't know everything, and we're learning as we go. And one of the things that we do is that as one physician learns something, we spread the word to other physicians. So emergency doctors and critical care doctors started realizing that early intubation for some of these patients was causing problems. And so practices have changed pretty radically in a short amount of time. Now, that doesn't mean that intubation is bad. It just means that these people don't do well. But if they're in respiratory failure, if they stop breathing, they're going to die. So if it gets to that point, either they've got a 100% chance of dying, or if we put them on a ventilator, they got a 60% chance of dying. But it's better than zero. So those are kind of things. Now we're also starting to see. I had someone that came in last night that had a heart-related problem that they never had before, and they had been in the hospital for COVID 2 weeks ago. And so one of the things we sort of wonder is, what are the long-term sequelae of this infection? We think that the virus binds to these ACE2 receptors that are found in cardiovascular tissue. And are people who have had these severe infections, are they going to develop heart disease or other problems later on? I don't know if the studies are still out. It was interesting that this person came in last night in heart failure who had never had it before, and it's 2 weeks after this infection. So those are the things that make you go, do I know that that's related? I don't, but when more of these cases are sort of studied, we may have an answer to that. We're still seeing, the bread and butter emergency medicine things. I had a guy this morning overdosed on heroin. Another guy who, apparently did something to his girlfriend, and she stabbed him 7 or 8 times. So interpersonal violence, substance abuse, those things are there as well. We're seeing a little bit more of that, and I think that's part of the lockdown. We've talked about, our concerns that the lockdown has its own costs and its own medical costs in terms of domestic abuse and violence, substance abuse, in poverty, and things like that. And I've been advocating that we need to reopen in a sort of structured, sane way, and we'll talk about that some more maybe later this week. All in all, things seem like they are, our volumes are still down, but they're not. It's not like I'm sitting around doing crossword puzzles all night. I was busy the whole night, a little tired this morning. One of the things I wanted to talk about also was, last night I posted this question about whether or not anybody knew anybody with COVID-19. And I posted that because I was going to kind of use it as an example to illustrate that, even though we've had 1.4 million cases and 80,000 deaths, look at all these people, hardly anybody knows anybody that's had it. And I was surprised because between YouTube and Facebook and Instagram, there are over 300 responses as of this morning. And a significant majority either know one, at least one person, but many people know 10 or 12. And unfortunately, many people know somebody who's died of this. And that was surprising. And one of the reasons I posed that question is because just over the weekend, I went from knowing, personally knowing, not outside the hospital, but personally knowing only two or three people that had the virus to all of a sudden having about 12 to 15, and just learned about a bunch of people I had no idea over the weekend. And some of them here in North Carolina, some of them are in California, some of them are in New York, one of them was in Pennsylvania, but that people I hadn't talked to that I didn't realize. And if you read through those comments, it's very interesting. And I think if people are telling you this virus isn't real, and I've been getting told that because of some of the stuff I've gotten pushback from my response to that pandemic video, and I've had people mention, send me messages, this is all a hoax, there's not such a thing, these death numbers don't mean anything. Well, don't take my word for it. Read through the comments. I mean, clearly people are being touched by this virus. And if you don't believe, many people are posting sort of these nasty things, don't want to hear any proof you give them is tainted by whoever. But, these are normal people. These are regular people just like you and me that are posting, and they don't have any agenda. And so read through those comments and look at how many people have been touched by this virus. And remember, it's only been like 0.6% of the population has been infected. So, less than 1% of the population, and yet all these people have had the virus touch their lives in some way or another. We got a little taste on Facebook of some of the stuff that's over much more prevalent on YouTube about kind of people that I don't know, if they don't really, I get it, people are scared and they want to lash out at people, and sometimes they lash out at the messengers, and I understand. I don't begrudge people. I would just, ask people, let's try to be civil. Let's try to have a civil discussion about these things. If we don't agree, then let's show each other our evidence. Let's try to provide proof of what we're saying, and not just call people names and say that you're paid off by this person or that person. I mean, you folks that haven't been with me, the whole time I've been broadcasting these videos since the very beginning. I mean, I'm sure I have biases, but I try to keep this as unbiased as possible. And I would suggest if you think I'm some shill for whoever, conspiracy, big pharma, Bill Gates, whoever, go back and watch the 30 other videos in this series, and make your judgment based on the facts, not on some assumption made on what I'm talking about. I'm going to get off my soapbox. I'm tired. I'm a little cranky. That's probably why, so I apologize. I will be back tomorrow night with another video. I am going to try to arrange a panel discussion with some other physicians so people can directly ask physicians these questions about, are we being forced to diagnose COVID? I've talked to about 30 doctors. I haven't had a single one that's felt that they were being asked to do with anything unethical or illegal in terms of diagnosing people with COVID when they don't have it. I don't have anybody that's telling me that they're being told to bill Medicare or Medicaid in any fraudulent way. We all know that that's illegal and we don't want to go to jail or lose our licenses. But I'm going to try to gather some doctors together, and we'll do a Facebook Live maybe next week where you can actually ask those questions yourself. I will try to do a Facebook Live towards the end of the week myself, and so we'll take those questions there. In the meantime, take a look at the Facebook post, take a look at the YouTube post from last night, and read through those comments and see what your fellow Americans are going through. And if you have your own experiences, please add them. Say whether or not you know anybody that's had the virus, how many people, and where you're at in the country. And I think that will give us all a little bit of an unbiased view. These are just people that are watching these videos that are sort of giving their own local reporting. And I don't think anybody can say that that's biased by anything other than our own personal experience. As I always say, wash your hands, take care of yourselves, take care of those around you, take care of your families. If you find these at all valuable at all, please subscribe to our YouTube channel, hit the bell so you get indications when we post. Like us and follow us on Facebook, our Instagram, and all the other things. And I'm going to be expanding the wellness content. We finally have got our online weight loss program up and running, and our website we've got our health coaches trained up. We've been working hard on that stuff, and so I promise we're going to stop always talking about the virus, and we're going to start talking about some of the things that I'm passionate about wellness, about fitness, nutrition, sleep, stress, hormones, all the things that I kind of opened our clinic for, and that I really am excited about, that I think can really change lives. But we're going to add some of that content in as we go along. I'm tired. Thank you for your viewership, and I will talk to you tomorrow. Good night.